invitation. Over to you, Rene.
Thank you, Mary Ann, and welcome everyone from my side. For you that don't know SCT, we are a health and hygiene company, and our SCT brand's looking after 1 billion people around 150 countries. SCT's purpose is really to have these barriers to well-being, to support our athletes, our healthcare practitioners, and our patients in their journey of performance, care, as well as recovery. Here at Leuko Sports, is a massive flagship brand for SCT. It's endorsed and used by many professional teams such as the Springboks, the Vodacom Bulls, Isuzu Daisies, and so forth. Our product is really there to support prevention of injuries, but also recovery of injuries. Our brand is really strong in the strapping market. And last year we did some research on how people really buy strapping. And first thing that came out was education around sports strapping, but not only how to use the strapping or techniques, but also how to use the correct product. And that is why we have this whole evening together tonight. To make this evening really special, we have got two amazing players here tonight, Nama Kaba and Shanique Alexander. Great players here to actually physically being strapped by the one and only Rene Naylor. So she's definitely the star of the show tonight, and she's really going to show you some great techniques that not only she uses in her practice, but also what she used to use at the box. So enjoy this evening and have a beautiful, great education on sports strapping. Rene, if you don't mind to join us.
Hi.
Good, good, good.
Thanks for that intro. Yes, it's going to be quite an exciting evening. Before we dive into all the techniques and the strapping, I just want to reflect a little bit on my journey, that led me here. It's been very special to have been part of the Springbok, team for over 15 years. And, those special moments of, bringing back the Webb Ellis Trophy to our beautiful country, you just, it will always leave a mark. But for me, it's not just that, and not just the test caps. It's about that resilience, the resilience that every player shows to get to that level of excellence. And there's often just a strapping in hand as part of that process. And I think about a very special player in 2023 that really had to struggle to get back after injury. That was our captain, Siya Kolisi. He injured himself, and you're going to see a video now of how he injured himself in a URC game, and I was sitting at home watching this game and worried, because this is so close to the World Cup. How are we going to manage if this turns out to be a serious injury? And if you look, if you look and watch how the pivotal action that happens at his knee when he actually injures himself, you can see that when this is a typical way that we injure the ACL. Non-contact and rotation, and this is from a different angle. After he passes to Leuko, or Leuko gives an offload to him, you see how he steps into it, and there you can see in that right knee what happens. And that is your mechanism of your ACL. Now, ACL, some of you may know, does not just heal quickly. It takes 6 to 9 months to recover, and it has to be fixed. You can see here, this has to be surgically repaired. And it was very important for me that Sunday after the injury was lots of phone calls about what are we going to do. Some people were saying, no, let's not do the surgery because otherwise he won't get to the World Cup. And, for me it was important that he did fix it. And then we would fight and work hard and see if he could make the World Cup. And it was an amazing process because I got to work with such an incredible team of doctors and physios and IT specialists and coaches from all over South Africa and globally that gave their input, because we only had 133 days to the start of the World Cup to kick off. But 6 to 9 months is 275 days. And you can see here that there's so many milestones and so many criteria you needed to get through. And we managed to get him back in 113 days. That's just short, 4 months. And that was dedication. That was 3 hours a day that Sia gave, his mindset and hard work to get him there. And I'm now going to just end off by showing you a little video of that process of getting him to this first game of the World Cup. So let's start off, see that we've just finished off with Sia's video. We're going to start off and kick off our webinar with the knee strapping. So the most common injuries in rugby is your MCL and your LCL, your medial and your lateral ligament. And we have Nama's just going to give us his knee, and unfortunately he put on some body lotion. So it's not ashy. So, and I'm going to just come over on the side. Besides the ACL, you're also going to get your medial and lateral collateral ligaments. The first thing is to ask, what is the function of your strapping? What purpose? What do you want to achieve with your strapping? And in the case of the knee, you basically want to prevent, if it's the MCL, that valgus strain. If it's the LCL, it's the varus strain. So you're either doing it to prevent an injury or you're helping a player return from injury. Those are the different functions or purposes that you could be strapping a knee. And then the second thing is, how am I going to achieve that and what am I going to use? And I'm going to tell you tonight that there are so many different methods of achieving what you want, of giving you stability on the inside, the outside, or rotational stability. I'm going to look at what position I'm putting his knee in. 20 to 30 degrees of flexion. He can either sit on the edge, or sometimes you can stand and just put something under the heel to give you that 30 degrees angle. Then my anchors. So now I'm going to put my anchor below the patella and then one above. And it's important to check with your athlete, your player, if it's not too tight around the calf muscle. Okay, is that feeling okay? You can just tell me if any...
I've got small calves.
Okay, and then we're going to go one above. So you put our anchors, and usually a player will tell you where they want it, especially if he's, jumping in the line out. He doesn't want this one, to be too high or too low. It must just be at the right height. Okay, so now I've put my 75 Leuko S. This is your elastic adhesive bandage, okay? And then I'm going to go to your rigid bandage, and the rigid bandage is your Leuko P. So whenever I say Leuko P, just remember it's the rigid taping. And so now I'm going to first do the medial side, and I'm basically going to go, here we go. I can't step with this side, we're going to go here. Just go in front of it like that. Okay. And obviously the first thing is, which I haven't mentioned, is to make sure that the skin is not, too much. Yes, exactly. And you can use your Hyperfix before you put your anchors on to actually give you a bit of under wrap. And that's optional. So in this case, we're just going to go, we're going to give you that medial support. And you can just overlap each strip that you're putting down, you can just overlap by 50%. There we go. And then you can just put some vertical strips as well over the actual medial ligament. There we go. There we go. That feels. Does that feel okay?
Yeah.
Okay, now I'm just going to go from this lateral tibia and I'm going to go over this side for your lateral ligament. And then you're just going to make sure it goes, because those vertical ones just going over the joint line to give you that lateral support. There we go. And it's very important to make sure, if it's the first time you're strapping someone, to make sure that they're comfortable with it. At the end of the taping, we're going to do, there we go. How does that feel?
Feels solid.
And the last one I'm going to put over here. So now, sometimes even with my ACLs, that's sufficient. But if you want to prevent the rotational force, you're going to take it from the medial tibia. And you're going to go this way. There we go. And you're going to bring it to the lateral thigh. There we go. And then we'll do it from the other side as well. Basically from the lateral posterior tibia okay, you can basically go back, and that will almost prevent. So with the ACL, you want to prevent the rotation, and you also want to prevent the hyperextension, because that is also sometimes if you've got an ACL that's lax, you want to actually prevent that. And you know, player will tell you how much you need to use. So in his case, how does that feel?
Extend too much.
Yes, exactly. You're really
That's the
solid
point,
here.
yeah.
Okay. And so after this, you can basically cover up with either light plaster, but I'm going to use the 75 because you're big. Okay, and then you can go back to your Leuko and to close it up. Okay. There we go. That's it. And some players don't like the back of their knee covered, whereas others really like to have it supported. So I'm just going to do two flaps on this side. There we go. Is that okay like that?
Yeah.
And I'm going to end it in front. There we go. And the thing, you know, because there's so many different ways that players like to have it taped. There we go. How does that feel?
Feels pretty solid, eh?
You're not going anywhere with that. But if it feels uncomfortable, just get another 75. And I'll put a rigid. I usually just use a rigid to close it off. Okay, and this one I may have to put another piece over there. Here we go. To just close it off there. But if he doesn't feel comfortable with it, then you redo it. That's the important thing. You have to do an assessment afterwards and find out if the player is feeling discomfort, or if he's functional, if you're able to still walk. Can you stand and do a little squat for me? That's okay. Can you still do a lunge for me? Let me take this out of the way. Can you do a lunge? You're still okay, and it's still supporting you?
Yeah.
Okay, that's good, that's good. Okay, so we've now covered medial lateral stability and the ACL. Now I'm going to show you some patella. Okay, so now I'm going to put you can go and have a seat.
Yeah.
Yes, Shanique is going to come. So often patella tracking problems is seen in the females. Female athletes. Let me just tidy up here a bit. And the most important thing is to look at, the first question is, what do I want to achieve? What is the purpose of my taping? And what is actually happening with the patella? Why is it tracking? So often the reason is because we have lots of tight structures on the outside of the knee, of the patella. So basically your ITB is very tight. Yes, ITB is tight. Your patella retinaculum is very tight, so that, the patella is now sitting on the lateral side. And sometimes also weak glutes, because if the glutes are weak, it means that the patella won't track properly, because that is your main stabilizer for the knee. And so what we want to achieve with the tape, which we can either use K-tape, and then I always say, how are you going to achieve it, and with what? And that depends on what you have available to you. So if you have K-tape, you use K-tape. If you don't have K-tape, you can use your Hyperfix and rigid, or just rigid, like the old days we said McConnell tape. So I'm going to do it one with this, and we'll do the other one with that tape. Okay, so then this I maybe cut too much. So you basically want to take it on the outside and you're shifting. Because the patella is coming too much to this side, you're doing that action. Okay, so you're just gliding. So you're basically doing a medial glide of the patella. Does it feel like it's shifted a little bit? There we go. And then I'm going to do the second one. I'm just overlapping with my Examol. This is just your under wrap, just to protect the skin. I didn't do this with Nama. Sorry, Nama, but for the ladies, the skin is more sensitive. So, and then I'm going to take again remember this is your P, your rigid tape, that's going to do the actual work of shifting and making that patella glide. And I'm taking a piece there, and I'm shifting, moving that patella over. I'm just exaggerating it. And this is also trial and error, because you're going to test what's actually happening after you've taped it. Does your player feel better? That's the one method. Before we test you, I'm going to do the other method on the other side. And with K-tape, I often find that with different players, I do different techniques. So this is the one technique that you do to lift the patella, and sometimes you do a technique to actually glide. So this is the one where I just use all the pieces. It's a short, depending obviously on the size of your athlete. So I'm actually now, I should be standing on that side, but they won't see. So you first put down your anchor where there's no tension, and then this portion will have a bit of tension, 50% tension, and I'm taking it there. So now I'm trying to lift it, okay? And then the anchor again, the small piece at the end, I've got no tension. So you can actually see how the tape even looks different, where you're putting some tension on it. And this is now the Leuko K, your kinesio tape. Okay, so now we're going to go this way again. No tension on my anchor. And there I'm going to do, oopsie, that's not good. You don't want it to get any creases. And this is because I'm standing on the opposite side. There we go. I may have cut this too long, but I'm just going to go there. There you go. So I want to pull it. And you do look like it's a bit gliding to the outside. And there we go. We're lifting it up. And sometimes you're doing this to relieve pain, reduce the pain, to give some proprioceptive input. And in other cases, it's also to facilitate the proprioception when you're busy with your rehab. So before you do your rehab exercises, you don't want that buckling when you're doing your single leg exercise work. So then I can sometimes, I overlap by 50%. Sometimes they say you shouldn't. And then you're taking it there and giving it. And then there's no, and in this case, it's slightly different to just the glide. I'm actually trying to lift it. Okay, try and straighten, just relax it. That's exactly the effect I want. So I'm actually just taking all the pressure off the tendon and the patella and the bursa. So you do want it to look like that. It must look like it's all, and there we go. That's it. Okay, and then we do a functional test. You can get off the bed and we look, can you do a squat? Can you walk? Is it comfortable? How does it feel? And I wanted you to do a single leg quarter squat because this is usually the one that gives you the symptoms, and then you can tell me how that feels. Okay, and so you always check. And don't be upset if the player tells you it feels terrible, makes no difference. You try again, you try a different technique, especially if it's the first time you're taping someone. You need to go about trial and error. Okay, we're going to now move on to the shoulder. So now I'm going to ask someone else to come back. Nama's going to show us his shoulders. You're maybe going to sit at the edge here. So now we're again going to ask ourselves the question, what do we want to achieve? What is our purpose for strapping the shoulder? What is the function of the tape? So we can be using the tape to give complete support for an anterior shoulder instability, because your posterior glenohumeral instability is not very common. It's mostly that the glenohumeral head will sublux anteriorly. So it's usually when you put the player in this position, he has a little bit of apprehension. His apprehension is positive because the glenohumeral wants to come forward. That's the one area we can strap. We also have a lot of AC joint problems. That's when you're falling on the tip of your shoulder and the AC is sore, and that movement is the most painful. And then you want to strap to actually give stability and to reduce the pain and to allow the player to function when you do that strapping. And of course the shoulder, you can also do strapping for the scapula. If there's dyskinesis, you can use it to activate muscles that are weak, and that we often use the physio tape, the K tape. So let's do a full shoulder on the other side. I'm going to take so now here it's going to become important that I use my under wrap. not everyone uses under wrap. And because, you know, with any strappy, you're going to check that your skin is dry and it's clean. And obviously the spray, the tensor spray is, do you want me to use spray or are you fine without spray?
Yeah, it's fine with spray. It's just a bit cold, but yeah, it's fine.
Fine to spray. So this is just to help that we don't, because obviously he's going to go play a game and he's going to sweat and it's going to come loose and you have to redo it. So you're going to just let me spray some, or sometimes players like to do this themselves to make sure it sticks. And then the important thing is the joint in the functional position? So sometimes we just want him to keep it like that. So I'm going to put my under wrap first. So, there we go, yeah. There we go. I often cut this before, especially if it's match time, because there's, you know, you're always so stressed with the time. We're having 5 minutes to do each joint. So you just want to make sure you've cut them before. There we go. And then I need a very small piece to cover it up here. Do you strap your shoulders?
I used to, yeah, but I just used to do the pad over the AC joint. But
Okay,
yeah,
we'll maybe do that on the other side. Okay, and there we go. So we covered up. And then we do the front, and so we've covered up everything with what this under wrap is our hyperfix. Okay, so now I've prepared it for the strapping, and now I'm going to move to my rigid, and this is our Leuko P. So I'm going to start. So some people, this is like personal preference, and I would ask if you want something around the arm now or just at the end, because lots of the players don't want to anchor, but you know, the books and, you know, but lots of players like to have mobility. I mean, your shoulder's the most mobile joint. You just want to prevent, for example, in this case, we're going to assume you need full taping because your rotator cuff, you've got an impingement, plus you've got the glenohumeral, you know, with instability, anterior shoulder instability. You know, so we're going to go, there we go. Just there. So now we're going to do our slings, cross, the shoulder joint, and if any piece doesn't feel good for you, you can just tell me. There we go. Now always just go 50% over. Tape it. In this case, I'm just going to go up here. And we make sure that we cover everyone. And then I'm going to go, I'm just going to take some sling straight over the joint. I'm going over here. If you can tell me that feels okay.
Yeah, so far so good.
And obviously some people just need 2 slings, but we've got a big boy here, so we're taking, we're going to put another sling. Yeah. And then you can take a strip that actually does that. You can bring it forward. Now this is important, but it's still, it gives you that support, but not limit the range. So often I would check as I'm doing the taping to see how does he feel. Does he still feel? You can get Get to the top, yes.
Still mobile's enough.
Still mobile, but is it giving you enough support? And
Yeah.
then the player
Yeah.
will say to you, I need another piece, it doesn't feel good enough. So, you know, you're always just communicating with your athlete about how much tape he wants over it. And then there's an option that some athletes would want you to use, the EAB, the adhesive, this is your Leuko S, to actually do a 6, or my athletes, I often found that they would just want me to cover it up here because they don't want too much on their shoulder. And we'll just do that to protect the shoulder. And we'll basically use, I can use my Hyperfix. Let me see, where's my Hyperfix? I did actually cut 2 strips of it. Probably lost it somewhere. So we'll go like this, and we'll secure it like that. Okay, and then I'll take another piece at the back and secure it at the back. Obviously, I'm going to show you on the other side if I had to do. So now, let's assume you've also got an AC, okay? We could have used, we could have used the other, you know, instead of strapping up your other shoulder. So we've got the shoulder strapped up. Now you've got an AC problem. What do we have? I've actually just, before we started the webinar, you can ask your players to do this because they all have their own methods of making their AC support. You know, some use this material, some use felt. You can use bubble paper, whatever you have to actually give that donut. Some don't even use a donut, they just want a complete piece that they're basically going to now put onto the shoulder in that position. And then I'm going to use this to secure it and then cover it with, so in the case, let's just keep it like that. I'm going to cut another piece. And some, you know, back in the day, when there was lots of money, we used to use what we called the jelly. Remember that?
Yeah, I do. Yeah.
Looked like calamari.
Yeah, we used to call it calamari.
Call it calamari.
Yeah,
They want,
yeah.
and some players have custom-made support for the AC joint. So, I mean, it's a very common injury is your AC. And most of the players, some players just want the donut. They don't want anything in addition to it. So they just want you to actually do this. But then there would be players that you'd have to do, and particularly if it's a new injury, they'd want you to then put a rigid over that. So let me just secure it there for you. So now I've secured, he's ready for a tackle. Okay, and I could use now my rigid over it if I want to give him some extra support. You can see that. There we go. Let's take it down there. I hope you guys are actually, some of you are actually trying to strap at home. Have some tape there and trying to do it with me, and you can get a feel of using this tape. There we go. We got. This is quite a, you know, there would be problems if they came into the change room to measure. You want a lot of support, eh? It's like.
I think it's soft enough.
Yes.
Yeah, it's not hazardous, this one. Yeah.
Okay, and then and some secure with rigid over here, but I find that often the rigid, when it gets sweaty, you know, it comes loose. I like to use a piece of Fix-A-Mol like that, and then just secure him there. And then also at the back. And then the important thing is obviously to make sure that he can do his movements. Okay, so let's move and let's see how does that feel?
Yeah, ready for a tackle, huh?
Yes.
Yeah, that's
So
really
feels good, but you can still, if you feel he's got too much and you don't want him to go there because of his anterior instability, you would just be putting more of these slings that I put along there. But, you know, and this is one way. There's different ways. The shoulders, you know, it depends on preference, what the player likes. So now I'm going to move to the ankle. Okay, Shanique, you want to come and we're going to do the ankle. Thank you. Okay, I think you're going to take off your socks for me. Let me take all of this away. Maybe I'm going to ask you to sit facing this way for me. So the most common injury is ankle. You're going to take off, maybe you should take this one off as well. There you go. Let me take this out of the way. Here we go. You want to come with your foot a little bit over the edge of the bed. So we've got the common ankle injuries is your lateral ankle sprain. You can also get the ankle sprain. You can get the high ankle sprain, high grade, or what we call a syndesmosis injury, which is you actually have had a few of those. We should have used you. You'd have been an expert. And of course your Achilles tendinopathies. So what I'm going to do is, I think we'll start off, because we're going to build on it, so we're going to start off with a basic, let's start off with a syndesmosis, let's do that, and then, or do an ankle and add the Achilles last. So the most important, I'm going to cut some of this just to protect. I find that with the ankle, oh gosh, you know, I'm thinking of big rugby players. I could actually have used the Hyperfix for you. It would have been more appropriate to use this. And I'm just going to do, because I find that this area of the skin is so sensitive, so it does well to just put a piece like that. Okay, and then we're going to do our anchors. And what is the function and purpose of our tape now? What do we want to prevent? We want to prevent, if it's a lateral ankle sprain, ATFL, or the calcaneofibular ligament, we basically want to prevent the plantar inversion. Okay, so we want to keep the foot in an eversion position. Okay, and obviously the opposite, when we have a deltoid sprain or a medial ankle sprain, or the syndesmosis, which includes the rotational force, the eversion force that has happened to the ankle. So always just go back to, what do I want to achieve? What is the purpose of my taping, and how am I going to achieve it? What tape am I going to use for it? And use the tape that you have available and make it work. That's often what I say. So come a little bit over the edge, and often athletes will tell you at what level if they're used to strapping their ankle. Shanique, do you normally strap your ankle? No, you don't. So I'm just going to do the first anchor there, and then you can do an anchor on the foot. Most of my players don't like an anchor on the foot because they feel it sometimes limits their movement. So I'm going to, leave it like that. And then I'm going to take, sorry, that bothers me. So if you want to do, we're going to do one for the syndesmosis. We're going to go like that. Do it like that. another piece. Just do this. And now we're going, taking it this way. I should do one the other way as well. Tight. Let me just get a piece there, because you're high. You basically want to go over the anterior aspect of the ligament, and you're basically crossing over. My crossover is not that good today. There we go. Pull it as tight as I can. Basically, to just give you support over the anterior aspect like that. Okay, so now that's basically for your high grade sprain, and then I'm going to do just a normal for your lateral ankle sprain. I'm going to put some slings. There we go. You want to sit like that. But now the important is the position of the ankle. So I want to make sure that she's staying in eversion. And it's a nice petite ankle. Don't have to do too much here. And then I'm just going to do over 50% overlap. And make sure. Taking it over there, there we go. And now I can do my figure 6. Sorry, I'm just going to get, okay, I'm going over your heel. Am I going too tight over here? You can just let me know. I'm going to take another piece. This feels maybe an old piece of tape. Going like that. Try another one. So I'm using my rigid tape. This is your Leuko P. Okay, and I'm taking it over. Again, cross over and support there. So now, if I want to do, I'm going to do a heel lock on both sides with the rigid, because we're going to assume that you've got everything wrong. We've got medial and lateral. So I'm going to go from the inside. I'm going to go to the bottom, the heel. I'm going to go and lock it there. So you can see there. And often your players will tell you, I want a heel lock or I don't want a heel lock, how much support they want. And I'm going to take it over there. That's it. And now we're going to do the heel lock to the other side. So I'm going to now start on the medial side and then take it over the heel. So I'm locking this side of the heel. There we go. Okay, and we're doing that. Okay, so you can try and move it. Now, obviously important to check not only function after you've taped, but also circulation, the toes, the movement. It must still be functional, so they must still be able to go and play and do what they need to do. And I can close off wherever I want to and check how that feels. But now I've locked medial and lateral, and I'm just going to neaten it. So some players, this would be sufficient. You've neatened it. I just make sure that they don't get chafing over there, so I just do that. But now let's assume you've got your Achilles as well. So you're going to turn around, and I'm going to do your Achilles. You can lie on your tummy, Shanique. So So now I want to do an Achilles. Sometimes you can do the Achilles first if you're going to use K-tape, but I'm actually going to use the EAB. I'm going to make an Achilles for her with the EAB. So I'm going to use the 50 mils, and I'm going to take it from there to there. So I'm obviously assuming, so let's put in your, for this one, I'm going to put in a little anchor that we could have done. So we've got an anchor, just makes it easier. And I'm going to make an Achilles for her. So let's just assume this is going to be the length of her Achilles. And I'm going to cut along the line, the center. Because these two fingers are basically going to allow me to give tension. And I'm going to cut on top as well. There we go. And now I'm going to place it. So I'm going to pull it, put that piece down. You can just, I don't like the creases. So I'm going to put this piece down. There we go. And then I'm going to now, this is dependent on how much tension I want to take off the Achilles and allow function with minimal pain. And this is usually in your process of your rehab or is coming back to training. So the amount, and I can always lift this and make it tighter. You know, so I can cut a little bit more. And I can make it even tighter. So there you can see I've made it. You see that I've made an Achilles for her. And now I can also just take one. Which one was the nice one? This one. Okay, so now I'm going to take my rigid, and I'm going to put my rigid along the Achilles that I've just made for her, and I'm going to put one on each side. And going down onto the plantar surface of the foot, and then I'm taking another one. You've got such a nice small foot to tape. And then I'm going to go and do it that side as well. And now I'm going to actually take that and wrap it around my, there we go, and now she's got an Achilles. There we go. So you can actually see that we've got some tension there. And then you can obviously secure it with your adhesive, your Leuko S, and you can basically close it off there. Lift up for me. There we go. And this is very good when to take the pressure off the tendon. You can see that it's secure, and then always at the end we check. You want to turn around for me? We check. What do we check? We check circulation, we check comfort, secure, and you can secure again with a piece of rigid so it doesn't come loose. I like to do this, to just use a piece of that. And then it doesn't. This on this side as well. There we go. You can get up and you can have a look how that feels. Okay. You've got everything strapped there. Okay, and I'm going to ask you if we can do your lower back. Okay, so now lower back, there's lots of, different methods you could use. You could use K-tape for the lower back. I can show you, I think I've got that on a video, the technique we're going to use. Again, we're going to go back to what do we want to achieve? What is the function? What is the purpose? And that depends on what is actually the problem with the player. So if it is a problem of a facet joint in the lumbar spine, then extension is usually symptomatic compared to a disc. I'm being very generalized now, but just to make it easier. Whereas if it's a disc, then your lumbar flexion is going to be painful. So you almost want to limit that movement. So if it was lumbar flexion and I wanted to just take pressure off in the acute stage, I'd probably do a crossover in this position. And then I'm going to show you for the lumbar extension, we're going to do, I'm going to do 2 strips. I've probably cut this too long. We're going to do like that. I'm just cutting my edges of my K-tape. We're now using the Leuko K because this is going to, so I'm going to ask you to stand for me. Yeah, stand. Let's do, I'll do the strips and then I'm going to come over here and I'm going to ask you to bend forward for me, like there, like this. There we go, like this. I think I'm actually going to ask Nama to come and do this one, Nama. And I can do, you're going to do that and you can stand up for me. You stand up for me. Okay, and then I'm going to, so you can also use your K-tape, the technique I'm going to do for you, you can also use to facilitate the postural, the pelvic control. So you if you want to get the player to start activating his TAs and keeping his pelvis in the neutral position, you can also do your taping across. I don't like often with the players to use the K-tape around, you know, around the pelvis. I don't find it as secure. I would rather then go with the, when you use with you're so small, I'm going to go with this. It's nicer to do a little bit of this. Taking 2 of these. Okay, and then I must see your PAIS. There we go, like that. And then I'm going to ask you to just show me a bit. There we go. That's good. Taking a piece there. This is just to protect the skin. So I've cut this too short. That's not going to be good. That's not effective. It's too short. I like to go a little piece on this side as well. And you stand up straight for me, stand up straight, and activate the TAs, get your pelvis into position. There we go. There we go. Okay, she knows what to do. There we go. I'm going to take another piece. This is just to protect the skin. And you can do that. And then I'm going to use the rigid over it to just secure and get the right effect in the pelvis. There we go. So this is also very good for your SIJ. My forwards love it. They do it mainly for games, but sometimes before scrum sessions, just to give that extra support to the pelvic area and for the core. But this is not instead of your rehab. This is just in addition to your rehab that you're going to do this. Okay, we're going. Here we go. And that's okay. So that should be nice and secure in that area. Now I'm going to ask you, because you can take your t-shirt off. Thank you very much. You are going to stand. I may have cut this too short. Turn around for me. So just, okay. So I'm going to ask him now to bend forward. So to take the pressure off your erector spinae muscles, we're basically going, the first part, there's no tension. Take the tape off. There we go. Bend forward. Get it into stretch. There we go. That's it. And then the other side. And then I'm going to, they say you must activate the heat in. So let's see if I don't know about that. I think it's just to activate the glue. Get the glue going and then come up for me. And then you want to get that nice ripple effect where you're taking the tension off. You can see I got it good on this side. That side wasn't as effective. And this is another method. And then of course you can also do a taping where he'd be lying down, and we'll do from the PSIS and going across. that way and going across that way. My players haven't really wanted that sort of taping that high up, but that is another method of actually also helping. That's usually for someone that's in really acute lower back pain and they'd want that effect. So I hope that helps you guys with your taping techniques. And if we just recap, I think that the secret with taping is really to practice and to get to know your player as well as you can, and to get to know the tape and that's available to you and the different effects you can get with your tape, and of course to remember all your precautions and your red flags, when not to tape, when is it okay to tape. Those are all the important things. I'm going to now open for some Q&As and find out if there's anything that I can, answer for you guys that you're interested to see or to hear about. Okay. That's fine, it's fine, it's fine. Fine, it's all good. I'm going to hear if there's any questions. How do you feel? You're all strapped up? We can just talk a little bit while we wait. We can talk about the red flags. The red flags about when you're not going to tape. That's also important. You're not going to tape when the first thing is obviously the person you suspect a fracture. So the person can't weight bear on their ankle, and you haven't had the investigations done yet. You haven't had an X-ray done on that ankle. You won't just go and tape it with rigid tape and with EAB. You just use some compression bandage to just control the swelling. You would also not tape if there's some circulation or neurological dysfunction, or if there's open skin or a wound. You won't go and put this tape over. You'll be aware of all of those factors. Those are sort of your obvious red flags to not tape. And then, of course, you have to take the necessary precautions. If the person has had a small little scratch, you'd use a plaster or use a piece of gauze. Often my players already know before they're coming to sit down, they've already covered it up with a plaster, used their gauze, and they've sorted it out. And of course, this tape is not just used for these major body parts and the joints. It's also used for ears and used for the head. It's used for line-out jumping, and so it's got lots of different uses besides injury prevention and helping reduce pain and helping for proprioception and helping for reducing swelling and in different stages of your injury management. But I can tell you, you can go and anywhere without maybe an ultrasound machine or all the other expensive equipment we have if you go on a rugby tour, but you can never go without bags and bags of strapping. Like we took 20 of these with us to the World Cup, filled 23 kilograms each.
So Renee, we've got a few questions.
Yes.
The first question is just to explain the difference between the different tapings, like your Leuko tape P, kinesio tape, and EAB.
Okay, so the first one is your rigid that has less less tensile ability. So this is your most rigid, and this is going to be your most firm, and it's going to limit the most movement, is your Leuko P. There is also a different version, which I don't think I've got, is the premium, which is just a white version of this. It's also a type of rigid tape, but it's not as, I think someone's passing one to me now, no, but it's just less firm and rigid as the brown one. So if you want the most stability, oh, here we go, thank you, Roly. So this is your premium. So it's the same, it's also a rigid tape, but it's not as firm as the Leuko P, the premium, okay? So that's your rigid tape. And then, of course, you've got your K tape, which is, did I have a piece of it? Which is your kinesio tape, okay? So the kinesio tape is basically got a lot more tensile ability. So you can stretch it, and that is why you can get the effect of actually activating muscle with it, and you can also reduce load on muscle with it. So this is the function of when you would go to your K-tape. And this is going to be the less rigid form. It's not going to prevent movement when you're using your K-tape. So the minimal support. And you can use K-tape for any joint. So I always say, look at what do you want to achieve and what materials you have available, and you use those materials. And then we've got and of course then we've got the Leuko band S, which is your adhesive bandage, which is less rigid than your P, your Leuko tape P, but it can also be used to prevent and reduce movements in certain directions. You're always looking at the direction of your tape and what effect you want in terms of the joint mobility and the movement of the joint. I hope I've explained that well enough.
Then another one, different sports, do they use different types of strapping or strapping techniques?
Okay, different sport. So I think that if you go to different sport, they may favor different types of taping based on whether they're a contact sport or not. And certainly the amount of mobility they need. But the taping that we use on rugby players, I use in my practice on ballet dancers, on runners, on gym injuries or paddle or tennis. So yes, the same techniques that we apply here, they may not need a shoulder pad when they're going to play tennis, but they definitely get shoulder problems that need, and in those cases they may prefer a kinesio tape as opposed to a rigid because they're not in contact. But the principles of taping stays the same.
Thank you, Rene. Another one, and I think this is quite a common one. How do you know or decide when to tape and send a player back to the game, or when to take the player off?
Okay, so that's a tricky one because there's lots of variables you take into account. Obviously, if it's an isolated joint, the first thing for me is ask your player and know your player. The more you know about the player, the more you know. When I see certain players, like you hear at the Bulls, I think of Sos or Franco Morset, if he tells you he can't stand on his leg, you know it's serious. And you immediately know you have to take him off. You're not going to tape him. You have to look at, can the player weight bear? If the player cannot weight bear, if the player cannot run, you take him off. You don't bother to tape. Sometimes the player is going to tell you, no, I think I'm okay. And you then decide to tape him. You can do that. It's okay because you're going with the information you have at the time. And the information at the time, he tells you he can run. He feels fine. You test it. You don't find a severe instability in the joint. So you tape him. But then you watch him. And if he then shows he cannot perform what he's meant to do, he basically then will have to come off. So you have to watch after you've taped. You have to watch and see that that the player's able to function.
Thank you, Rene. Another question, how do I strap shin splints?
Okay, so shin splints you can use, maybe we should just do a, whose shins are we going to use? Maybe we're going to use your shins for now. Let's use Shanique. Yes, you can take here on the left side, we can just do. So I often go with, depending on how the shin splints presents, and if it's just localized area, so let's assume that it's just a localized area there, then I sometimes use, and then I go with, what do I have available for this athlete? So say, for example, I've got, let me use some Fixamol. Where did I put my Fixamol? Here we go. So we're going to use the Fixamol, which is just, and we're going to use 2 pieces like this. So we're almost going to do a similar technique to the medial glide of the patella. We're going to unload the shin in the area that is a problem. So it's just this portion, so we're going to take it like that. This is just to protect the skin, but I already, do a piece to unload. And then I take another piece here. So this is the area that is the most symptomatic for the shin, and then I take my rigid and I go basically, and then the important thing is I'm taking a piece to unload the area. And often in cases like shin splints, which is now your runner that's getting shin splints, or maybe a rugby player in the pre-season, that's the time. And obviously you guys here know, because your training fields are nice and hard. So you basically trial and error. Does this make a difference? No, yes, you check with your player. And then there are also techniques of using your K-tape, and you'll use a length of your K-tape, so you can use an eye, like you cut it like an eye, and then you can use a crossover also in this fashion with K-tape. That's another method that I use.
Right. How would you decide between strapping or bracing?
Okay, so the first thing I think for us in the context of rugby is your availability. So if I don't have access to bracing and the bracing that's going to be effective and comfortable for the player, I'm going to go with taping. I very seldom have players playing in bracing. For me, bracing is extra support when there's really a serious injury. So for example, it's a high-grade deltoid ligament that actually needs non-weight bearing. So he needs to be in a moon boot. He needs to be in a brace. That's the time that I basically go the route of bracing. Most of the time, if the player is training and he is playing, I tape. So that's, and I wouldn't put a player in taping if there's severe instability or any instability grade 2+. I'm going to think of a brace to give more stability to the joint, whether it's the knee or the ankle. Does that answer? Is there any other questions?
Yes. How would you strap plantar fascia?
Oh, plantar fascia is a nice, interesting one. You want to lie on your tummy. You must put your foot this side for me. Let me take this out of your way. Sorry, this is not a very neat physio room, but let's go with the fascia. So with plantar fascia, if you want to unload it, I'm going to show you a quick, just quickly. I'm not going to put, so you'd basically want your anchor, but I wasn't going to, let me just do it properly. So, we can put you like, maybe you must lie on your back for me first. Let me actually do it this way and get. So I usually, with the plantar fascia. So now for me, I put slings across underneath the foot, and the most important thing is what is the purpose? So I want to unload the fascia, so I use my second metatarsal and I push the second metatarsal down, and then I do my sling. So in that way, I'm creating, taking the pressure off and lifting the fascia, so you're almost doing that effect. So and then I'll do a few, usually I've got big feet that I strap, so then it's quite a few slings, but in her case, she's got very few, like little small feet, so I just do, it seems like 2 slings that will do. So basically, as I put it down, I would take her into that position to make her feel that she's lifting. See if that lifts already for you. Stand for me and just, because you basically want to lift the pressure off the fascia. Can you feel already? Yeah, and you can obviously neaten it up, but the idea is use that second metatarsal to get the effect and then do do your slings.
And there's also a request for a hamstring. How would you treat a hamstring and strap a hamstring?
Treat a hamstring. Okay. So we've got with hamstring groins, you've got the old school method that I sometimes use, where I would use depending on where the problem is and where I want to unload it, and what tape do you have available to you. So I've now don't have K-tape. I've just got old school tape. I've just got the EAB that I must use, and it's the hamstring. Let's do, you want to stand over here for me? I would do, so in some players, so I'll show you the K-tape as well, but for the old school, I'll basically use this as my under wrap, or you can use Hyperfix if you want to, but this is sometimes just easier and more firm on the leg. So I'm just going to do this. I'm just let's just imagine that you've got a bit of a hamstring problem there. But most of the time, by the time a guy's actually going full sprint, he doesn't really need, you know, and then basically we'd use, so I'm just going to go like, you know, take it this way around. So first, I'll take it off, and then I will check which area. So often it depends on which area of the hamstring. So I'll take the tension off. So say if the hamstring injury and pain, I should have, you know, had stars and just put, here's the area of pain. So I would do that and unload it in that area, so that you're taking the load off the particular area that's painful. That's just an old school method, and I do the same if it's the groin. So I just do a strip across. But if I'm using the K-tape, then you can use eye pieces along the line of the part of the hamstring that is problematic. So if it's along the bicep femoris, but then you can use, I maybe have to make this a bit shorter, otherwise I'm going to have too much tension. I'm not too great with the percentage of tension with K-tape. I usually go with what is effective for the player, and then I will do a crossover over the area that is a problem. So we'll do a little Y over that. How am I doing in time? Am I good? And then I'll just make sure I do my edges. There we go. So, and then, you know, you have to bend forward, put it on a bit of stretch. So if you just lean and just get a bit of stretch on the hammy. So we will go. So we're going to assume it's now on the out lateral side. So I'm going to, obviously my anchor with my K-tape doesn't have any tension, and then I'll put some tension along the area that's problematic, and then no tension at the top, so you can almost see the difference in the K-tape. And then I'm going to put another piece over here along. Sometimes they want it on both sides because both areas of the hamstring are problematic. There we go. So just take just there, and then my Y, I'm going to put basically depending. So now I'm assuming that my area is here. So then I'm going to take tension off that area. Obviously, my anchor doesn't have any tension, and then I'm going to take my finger and give it tension over the area that's affected, and then no tension there. And then I do a little bit of tension there and that. So sometimes this is used during the rehab process, and it also facilitates a bit of proprioception. You can stand up, At night, the athlete may use a transact, and then during the day, he's got that facilitating his movement and helping him to reduce his pain. Always remember, what is my function? What is my purpose? What do I want to achieve? And how can I achieve it with the tape I have? Is there any other questions?
I think there's a lot of young players out there, sports people, and they usually get this heel pain that they always say to their parents, listen, I've got this heel pain. What is that and how do you treat it?
Okay, so heel pain, the important thing is obviously to get a diagnosis, but you often have it, you must assess if it's a young player, if it's the growth plate. And you have to check, the growth plate at the knees, the Osgood-Schlatters, or at the calcaneus is your Sever's disease. So you need to find out if it is that, and then you want to look at their load, because that's usually an indication that they are loading their joints too much. Too many, I've seen it with young boys and girls, they're doing too many sporting codes and training too much. And that's one aspect you have to look at. But then to unload it, you basically want to give them cushioning and support if it's the heel, and see if that helps. If you give them a wedge, if you use cushioning or felt in the area, that's a problem.
And then the growth plates that you're talking about, is it maybe a way that you can strap it, or is it not really a way?
Well, you can strap to actually, change the position that's actually causing the pain. So if it's eversion of the foot, or if it's pronation, anti-pronation, then you'd look at that. Depending on the age, I'm not keen to put a young person with orthotics at a very young age, but sometimes if they're older, they may need to have orthotics or taping to see if the taping actually relieves and reduces the pain. But I don't have a specific,
Then also a good question regarding Leukotape K or kinesio tape. Do you only use that for recovery, for muscle, or can you also use it for stability after, say, for instance, a knee surgery?
Yes, of course. Yes, you can. That's why I'm saying that one has to be quite versatile and always be problem solving and using your clinical reasoning with what you have and what you want to achieve, because I've used a lot of K-tape to support the joint, to help reduce swelling in a joint while you're doing rehabilitation, and to give stability. So I sometimes use K-tape for the ankle. So you can, I don't know if they want me to, if I've got time to show, or can. Okay, so you want to, what have I got? Can I get your other ankle? No, your other ankle's covered in strapping. You want to give me an ankle?
Yeah.
He wants to give me an ankle. So let's, and also I feel that, you mustn't be scared to try a technique once you've worked out what you want to achieve with your player. So let's assume you've had a lateral ankle sprain, and so I want to just give you some stability.
Actually, I have one now.
You do, yeah?
No,
The side, that side. Okay, so let's see if we're effective with the K-tape, because there are players, but it's usually my backline players that don't like the heavy taping on their feet because they are fast and they don't want their feet limited at all, and they want to be able to, get their full weight. So I'm going to do, and so this I usually go according to, how much support. So you can do, sorry, I'm cutting this very badly now. But I would do the same thing that I would do with normal tape. I may have cut too long, but I'm going there. So once again, I'm going over, because I can see that's where he's got a problem. So it's a figure 6. So the advantage of using K-tape is that it is going to give you a proprioceptive input, and it can, with that proprioceptive input, prevent you from going into the unwanted position. But I'm not going to send a guy into a game, you know, if I really want to have, then I'm going to go with rigid, you know. So yeah, I'm keeping him in eversion. So a lot of it is about your direction of your tape and about the position of the joint that you're putting the joint in the correct position to actually limit the movement. So that sometimes is sufficient for some people because you would feel that it's already keeping you there. But I can go further and I can even do a heel lock with K-tape. So let me just do my edges quickly. Ooh, I think I may have cut this a bit too short for you. Okay. But I've got my edges here. So we're going to go this way. Okay, this is supposed to happen when you're doing a webinar. Do that. Go there. Yes, of course. There we go. Still going to work. And then you're going to go at the heel. But it's important to note that this is not going to give you the same amount of support, and it's not the primary function of your K-tape. But I found that it has been effective. I've messed that up a bit. There we go. Okay, still worked. And you can tell me how it feels, and you don't have to, you can be honest. If it doesn't feel good.
I'm used to the rigid taping, so yeah.
Yeah, it's not going to feel the same amount of effect.
And you can see I've had a lot of ankle problems. So.
Yes. Yes, and especially if you've had a syndesmosis as well. But it's not impossible, because at the moment I'm actually treating athlete, and she doesn't want more. I mean, every time she just wants less and less, and of the K-tape. So there I've done the lock. But this is not the, not being the primary. But there we go. So that's just keeping the joint in the position, giving you the proprioceptive input. Stand and see if it's minimal. Any other questions?
I don't know. I think there's a lot of still questions coming. You'll also handle these questions throughout.
Yes.
Throughout, as long as it's on Facebook. I would just like to bring Mary Ann also back to do the thank yous and some additional information around the CPD points. I see there's quite a lot of questions around that, yeah?
Yeah, so I think first of all, I just want to say a heartfelt thank you to you, Rene. Your insights and your experience is absolutely invaluable to us. So it's really been an insightful session, and I think for Leuko Sports, one of our pillars is really education. So if you need to get hold of us as well for anything to do with education, we work with schools, we work with clubs as well, rugby clubs and sports clubs. Contact us via our Facebook page. And then for CPD accreditation, so if you've been joining as a healthcare professional for CEU points, you'll see the link posted in the chat on YouTube, and also for Facebook, it should be popping up in your screen shortly. So all you need to do is follow that link and complete your details, and we'll submit your information to the HPCSA for CPD accreditation. I think one of the big things about Leuko Sports as well is for our consumers and somewhere where you can purchase it, one of the big things is that we are available now in Dis-Chem and independent pharmacy. So if you would like to receive a 30% off discount voucher, please also complete the same form and we'll send you a virtual voucher by email. Thank you.
I would also just to apologize from our side. We had some issues on Facebook and we really tried to sort it out, so apologies for that. But the whole strapping webinar is recorded, so you can go and watch it over and over again. And then lastly, for our real stars, and it's upcoming stars, Nikki, Nama, thanks so much.
Absolutely.
I hope you're all good straps and are ready for the season.
Too much
And
strapping.
good luck with the season going forward, and have a great injury-free season.
And good luck for removing your strapping as
Yeah.
well, because it might be a bit painful.
I'll help him.
It's always better after a game.
Amazing.
Thank
Just
you.
maybe on that topic, when is the best time to remove strapping and how to remove strapping? Rene?
Yes, you do have tape remover, and we usually remove it before they go and shower. But I must say that my players have managed to keep their strapping on after a World Cup final for 48 hours, even travel back to South Africa, and this strapping still holds. So I can tell you this strapping is really good.
So, thank you very much, guys. Thanks for joining, and looking forward to our next strapping webinar.
Thank you.
Thank you. Thank you, guys. Thank you. Thank you.
Oh, thank you so much.
読み直しているで読み直しているだけがで読み直しているで読み直しているで読み直しているで読み直しているで読み直しているエキスしたいとで読み直しているで読み直しているだけがで読み直しているで読み直している